Okay, well, if you could introduce yourself and the name of your practice.
Hi, I'm Dr. Maleigha White. I'm a naturopathic doctor at Toledo Naturopathic, which is my private practice.
And our question for you this month is, do you see many patients that have issues with gluten, and how do you find it?
I do see many patients that have issues with gluten. There's a couple ways that we can go about finding a gluten sensitivity. From the conventional standpoint, typically conventional doctors will look at blood tests or do a biopsy of the small intestine to diagnose celiac disease. But what we're finding is more and more patients are not necessarily having celiac disease, but having what's called a gluten sensitivity or gluten intolerance. Every patient that walks in through my door does a diet diary for 1 week, and for that they record what they eat for breakfast, lunch, and dinner, and any symptoms that are correlated. Sometimes just from completing a diet diary, we're able to see if there's any correlation with what they're eating and what symptoms they have, which could go back to having wheat or gluten. Other ways that we can go about finding those problems would be strictly just eliminating gluten from their diet to see how they feel. Typically we do that for a period of a month, or do blood testing that looks at more of a long-term response to gluten that's called food sensitivity, food allergy testing, which is a simple finger stick test where we look at the blood, we send it off to a lab, and they're able to see if there's any long-term issues that could be arising from the different foods they're eating. Gluten, and then there's many other foods that can be involved as well.
And if people have more questions for you, what's the best way to reach you?
The best way, you can go to my website, which is ToledoNaturopathic.com. You can also search me under Facebook, and I'm posting updates all the time, and I do answer questions as well for patients.